So hi, Massey.
Hi,
So how old are you?
I am 20 right now.
Okay. So you came to the office with a horrible pain, and then you said, "Oh, doctor,
Yeah,
I have an abscess," and I'm like, "What do you mean? You're 20 years old."
yeah,
So you show me the CT scan,
yeah.
and the CT scan showed that you had an abscess that was so big into the sinus and into the palate, and you were having pain because the pain was coming from the palate. So you had an abscess and some discharge of pus coming
Yeah.
out of the palate.
Yeah.
So tell me, what do you think happened? Like, how do you get an abscess at 20
I
years old?
I honestly have no idea. I've never that tooth didn't even have a cavity.
Right.
You
No
know?
cavity.
No cavity, no nothing.
So did you have an accident?
Nothing, not an accident that injured that side. All I've had is braces.
Braces.
Right? I had braces. It was a very fast treatment. I feel like maybe they moved too soon, maybe
Okay.
too fast.
So possibly trauma from
Yeah.
the movement of the teeth
Yeah.
too fast, and then the nerve died.
Exactly. And so
Okay.
then I started to get pain.
So that can happen, yes.
Mhm.
So the reasons why somebody get an abscess, okay, could be that they had a car accident and the thing blew up in their face,
Yeah.
that
The airbag. Yeah.
that airbag, that impact can kill a tooth.
Yeah.
So people that are watching, can think. It could have been that you were drinking on a glass and somebody pushed it and then they hit the tooth.
Yeah.
You were playing ball and then something hit your face.
Exactly.
Or even somebody playing around, they elbow you. That could happen.
Exactly.
So getting a tooth that is dead is not that difficult.
Exactly.
Okay? So dental work also, when you get dental work, easily moving the teeth fast or cutting the teeth or the decay being too close, but you did not have any cavity.
Nope, no cavity. That's why I was like, how am I getting and it was a big abscess. It wasn't small.
It was huge.
It was huge. And
Yeah.
I was so disappointed in myself because I was like, I have taken care of my teeth so well. Like, this is not like me at all. Like, I was just so worried. So I had seen it in January of 2019. Remember that I had seen it really early on, and I was like, okay, I don't know what I'm gonna do. Let me just figure it out. I'll take some antibiotics. Maybe it goes down. Antibiotics didn't
It'll never work. Yeah.
It was a way too
When
big
it's
of
dead, you gotta get it out.
when it's dead and it's an infection that big, that's it. It's game over. So
Yeah.
I waited too long, and then it was around September
Yes.
or the ending of August that my tooth started to move.
9 months after.
Yeah, I waited too long. So at the time,
She was thinking about what to do, but she
was
knew what she
thinking.
needed to do working in
Yeah.
my office.
Yep. I was like, I don't know, root canal's not an option. So I was like, all right, let me get it out.
So why would root canal not be an option? But if people don't know why not?
Well, I mean, we see people that come in with root canals that are old and abscessed, and they have cancer, they're sick, they have all these different symptoms. We have seen so much, a huge variety of patients that are coming in with different symptoms, and I didn't want to have to go through that. Why would I put myself through that if I know I'm going to end up getting it removed later on, 10 years, 5 years down the line? And plus I'm young, so I didn't want to do that. So I felt like best option was to just remove it and get it over with, and then have something long-term like an implant, which obviously is not an option just yet because it was a big infection and I still have to wait for my bone to heal, but it's on its way.
So do you feel any symptoms affecting the organs that are connected to that tooth? That tooth is like urinary tract, ovaries, infection,
Yeah.
kidney pain.
Yeah, so actually all of 2019 I had these symptoms with my ovaries. Remember I would tell you sometimes that I would get these clots and it was really bad, and I have never had any pain. Before I had my braces, I already had my period. I have never had pain like that.
Yeah, you were. Yeah.
So
you
I
would
don't
get really sick.
I would get so sick, and then I don't know if it was that something flared up in my ovaries and then traveled through the meridian to that tooth and then started to mess with it. I don't know where it started, but I know that I was suffering with some ovary symptoms. I also was getting a lot of headaches, and it was just a whole mess.
What about any sinus problems? So you were not there
Yeah,
because that
not-
was bad.
Not yet. No, I guess not. But I would get like congested pretty
Mhm.
often.
Yeah. So your case is very beautiful because we do a lot of extractions, but I was in shock when we opened and removed the tooth at the size of the hole and the size of the abscess that she had. We removed a cyst that was actually already affecting the tooth next to it. So if she didn't take that out, then we were going to have to remove 2 teeth
Yep.
because the other one hopefully is not damaged. So
Yeah, you got everything out good though. I wasn't feeling anything. The surgery was perfect. She used the laser. She used the PS. She used everything she had. Direct antibiotic. Everything was perfect. And I mean,
we did acid water,
You did
colloidal
acid, yeah.
silver, we did peroxide, we did ozone, we did saline,
everything. You used
Yeah.
everything in the book.
colloidal silver again. We spent maybe, I don't know, over an hour just removing the infection to make sure that nothing was remaining on that area.
Yeah, the tooth itself was pretty simple to come out because it was loose. It was already like moving about
There's
2
no
millimeters.
bone.
There's no
It was
bone.
removing the actual
Yeah.
infection that was spreading to the sides.
Yeah, everything was removed perfectly, and then thank God I could keep all the other teeth that were next to it because it had like
Yeah.
traveled to the sides, so it wasn't just the one tooth; it was already eating the bone next to it, so it was spreading. But thankfully, it was very, I guess, a microscopic amount that was spreading, and she was able to get everything out, and I had my teeth out. Just one was out.
So what would you recommend to somebody that is having the same issue?
I would recommend for them to obviously see a biological dentist because you want to be treated as a whole. You don't want to just have a person look at you and say, well, this teeth, these teeth need this tooth is going through this, so you should have this done. You need to know how it's affecting your overall health, I feel like, and a biological dentist is going to be able to take a look at you and treat you comprehensively and be able to tell you, well, this is affecting you in this way, dental, but it's also affecting this organ, it's also giving you these symptoms, and they're all, mixed, and they're all affecting each other, so you have to do something about it. And so thankfully, I was able to get it out, and I've had no issues anymore with my ovaries. I'm totally fine now, so I'm happy. So no root canals, that's not an option, that's horrible. You can get very sick from them. We've seen millions of patients that have had these traumas, so I don't feel like that's a good option at all. And then, just follow up with your doctor. Always make sure to keep on coming back and get it checked because it's not a one-time thing. It's follow-ups.
Yeah. So, my recommendation to anybody that's watching this video is visiting a hygienist every 2 to 3 months, getting your gums detoxified and removing any kind of pathogens or toxic loads in your mouth, like root canals, mercury, decay, gum infection, cavitations, can actually save your life. She's young and she's very healthy, and still it has taken her a while to recuperate on that area, and she's going to need further surgeries to build up that bone because it was quite a huge amount of bone. So we want to encourage you to visit a biological dentist every 6 months, not wait years. And if you have something small, just pick it in the butt. Don't wait so long that becomes so pathogenic that it's going to affect other organs and ovaries or prostate or breast or your brain. So we see on a daily basis people like Masi, and even younger. We have people that have developed acne on the areas where the abscesses are on the face, and then after removing the actual root cause of the problem, the skin clears out. We have patients with colon cancer, breast cancer, prostate cancer, lung cancer, brain cancer, and one of the most important things is that you remove the toxins in your life, not only your mouth, not only your body, but your mind, spiritually, and biologically in your homes. What things can you do to improve your environment? Because disease is multifactorial. It's not only one thing. One thing that I have seen with Vasi, that she has improved her diet, She has changed her diet. She's I haven't seen her eating pizza lately, but cheese and milk products have a lot of
Yeah.
bacteria that actually suppress your immune system, and then it affects your immune cells, the T cells and all that. So nowadays with COVID, we want to maximize that we are going to do everything in our power to stay healthy, to be strong, to get some rest, to drink water, to exercise, the basics. But something that is not so basic is to see a biological dentist and remove the toxins that you don't even know that you have.
Mm-hmm.
And then suddenly you get them out and you can breathe and you can think and you can process and you can retain information,
Yeah.
because we see people with neurological problems as well.
Mm-hmm. Yeah.
Thank you, Ms. Massey.
You're welcome. Thank
Congratulations on your new tooth soon.
Oh yeah. Very soon, hopefully.